So there are many clinical implications in recognition of germline variants, not only for the patient but also for family member at risk. And in particular, one example is to perform genetic counseling for these patients and the family members. So it is important to understand the natural history of these rare diseases. And so it is important to recognize these rare variants in order to understand the clinical and biological evolution of these diseases, and because we retain that some germline variants could predispose to a precise somatic variants. So it is very important to recognize these diseases. Also, for example, to achieve some endpoints regarding the treatment. For example, we have data regarding telomere biology disorder, in which we saw, for example, an effectiveness used of danazole in this subset of patients, or another example is the use of lenalidomide in DDX41 germline variants. Another important clinical implication is related to hematopoietic stem cell transplant. That is very important if we consider, for example, that in MDS patient it is the only curative treatment. And recognition of germline predisposition syndrome is essential to overcome some challenges, such as donor selection, because in some patients could be useful to perform a transplant with unrelated donor. Another issue regarding conditioning regimen. For example, some patients with a DNA repair defect could have some problem with the myeloid ablative regimen, and also to perform a personalized strategy for the follow-up of these patients after the transplant.